welcome back to my channel. I am Naya Patel and you are with me on the Mom Edition. So today we are going to talk about newborn jaundice, which is also called a neonatal jaundice. So jaundice is one of the most common complication that most of the newborn babies do have. It is rather not a complication but just a situation which needs to be managed well. We mothers have to be on top of it and make sure that the situation does not escalate and just manage it well in a way that it gradually decreases. So, jaundice is found in almost 3 out of 5 babies and it peaks usually in 5th or 7th day of baby's life, and then gradually it disappears on its own. So jaundice occurs because the level of bilirubin in the blood increases, and this bilirubin is yellow pigment. So what is bilirubin? So bilirubin is a residue, or you can say a waste product that is generated when our red blood cells break down. So in everybody's bodies, our blood cells are continuously regenerated. So the old blood cells are broken and the new blood cells are generated in order to take all that oxygen to our tissues, right? But in babies, this regeneration is faster. And when the babies are born, all their old blood cells start to break down faster and the body is making new blood cells. So when this breakdown happens, this waste of bilirubin is generated. So when the babies are in our tummy, our placenta is filtering out this bilirubin from our baby system. But in our bodies, bilirubin is processed by our livers and then excreted through urine and stools. That is why our urine and stools are yellowish in color, okay? But when the babies are born, their liver is not matured enough to process bilirubin effectively. So generally in all babies we see a hint of jaundice because of this very reason, that their liver is still not functioning properly. That is why the bilirubin is built up in their blood. But in babies with a considerable amount of jaundice, this bilirubin is escalated and it is more than what we would normally consider to be okay with. So in general cases, as the baby's livers start functioning, as they start feeding, as their digestive system kick-starts, they learn how to process this bilirubin and it is gradually excreted from the body through stools and urine. But in some babies, the liver might take a little more time to be matured, and especially for babies who are born prematurely, that is before 37 weeks, their liver is obviously not matured. So jaundice in cases of premature baby is also very common. Another reason why we see jaundice in newborns is because of the blood incompatibility. So this is generally well managed nowadays by our doctors, and our gynecologist usually takes care that this blood incompatibility is not a problem and the baby does not suffer jaundice because of that. So generally during our pregnancy itself, we are given an RH immunoglobulin injection just to make sure that if it is the case that our baby's blood is different from our blood, that is well managed. And also after delivery, the doctors will always check for the baby's blood type. So if the baby is Rh positive and the mother is Rh negative, the mother is once again given the injection to make sure that whatever Rh positive blood cells are there in the mother's blood, those are killed by this injection. So let me just try and make a video about this because I think it is an important information for you to have. Although doctors are on top of it nowadays and we don't have to worry too much about it, but it's just a good thing to know, okay? So Yeah, so that is one more reason why your baby could end up with jaundice, because of Rh blood incompatibility. The third reason could be infections. So obviously our body creates antibodies if we have infections. So because the baby is having infections, there are antibodies, and again these red blood cells are broken down. If so, I'm sure your doctor would take a lot of tests to confirm and then do the treatment accordingly. So now we know what is jaundice and why jaundice occurs in newborn. So let us now understand what are the symptoms that the babies have if the jaundice is increasing in severity. So number one, even a mildest jaundice baby will have yellow whites of the eyes. So because this bilirubin is yellow in color, it turns the whites of the eyes yellow. Again, the palms of the baby's skin, the soles of the baby's foot, the forehead, the abdominal area, all that will slowly start turning yellow, and you would see that your baby is pale in color, is yellowish, and is not red, and it's not looking fresh like we would want our baby to look. So that is one of the most important and most common way we would understand that our baby is showing symptoms of jaundice. The other symptoms include that the baby is feeling very lethargic, it is not feeding properly, the baby is not showing activity, and it's just very floppy, or it's just not able to be energetic, because the baby's body does not have that level of energy as our red blood cells are providing oxygen to our body, right? These red blood cells are breaking down, our body tissues is not getting the oxygen it should be getting. So basically the energy level of the baby is completely down. Also the babies might be crying continuously, we are not able to soothe the baby is feeling uncomfortable, uneasy. All these signs also will come along with the yellowing of the eyes and the skin. So how do we diagnose and confirm that okay, yes, this is jaundice? So it is possible that our baby is looking very yellow, but the level of bilirubin is not that high, and vice versa could also be true, that our baby is not looking very yellow, but still the levels of bilirubin are very high. So please don't go by your gut feeling that okay, this is not that yellow, or okay, this is very yellow, and you stress out completely. So even if there is a mild indication, if there is a mild yellowish texture to your baby's skin, you have to call up your pediatrician, because without having a proper test of the level of bilirubin in the baby's blood, it is impossible to suggest what severity of jaundice your baby is suffering. In normal babies who are born at the end of the term, generally levels less than 5 milligrams are considered normal, and if the levels are more than 10 milligrams, the doctor would say that yes, your baby is having jaundice which needs to be treated. Whereas in premature babies, levels more than 15 milligrams are considered as worrying. But obviously your doctor will tell you looking at the reports, and there are also many other factors like baby's weight, then overall health of the baby, etc. So obviously your doctor will decide and will let you know about the treatment plans, and if the baby needs to be hospitalized or not according to the reports that he studies. Nevertheless, we mothers should understand that the cell regeneration process is happening in your baby, and irrespective of whether the jaundice is high or low, there are certain things you have to take care and you have to be on top of from day one to ensure that you are supporting your baby's body to fight off this jaundice and to process all this bilirubin that is being generated in its body and to help it excrete from its body. So what all you can do, let's just see. So number one is, and even your doctor will suggest it, is you feed frequently. because in order to process the bilirubin, the baby's liver has to be kick-started. So we need to get that digestive system going, and we need to feed our baby so that they can create the matter to be digested, and this milk is converted into poop and urine, which will take bilirubin along with it when it is excreted. So we need to feed. That is the basic answer to helping your baby process this bilirubin. That is to kickstart its digestive system. So anyways, we know that we have to feed our babies at least 2 to 3 hours and every time on demand. So initially for some mothers, the milk also might not have come in. So we replace that with formula for the initial first 2-3 days and wait for our milk to come in. But obviously the baby's appetite is not that much, but still we have to keep feeding the baby to kickstart that digestive system. That is one thing. The second thing, a very common thing among the elders, and we call this like Dadi's nuskhas, is to keep the babies in sunlight. So basically sunlight helps the body to break down the bilirubin via photooxidization, and this bilirubin is converted into a form which can be easily digested by the liver, that is processed by the liver and excreted. But yes, even if your baby does not have very high levels of jaundice, and that mild level of jaundice which is mostly present in all the babies is gradually solved by exposing our babies to sunlight. But there are certain things that you have to keep in mind. First, number one, that you are not exposing the baby under very strong sun rays. So be sure to show the morning sun to the baby, or maybe the late afternoon sun when the sun rays are not very strong, because our baby's skin is very delicate and it might burn easily. So that is one thing. Second thing is, try and keep the baby uncovered. Only the private parts, that is the genital area, should be covered, and try and put a hat or something to prevent baby's eyes from direct sunlight if you are putting them in direct sunlight. So if most of the skin is exposed in the sun, the more surface area the better. So that is another thing. And pick a good spot, maybe like in front of the window, or if you're going to the terrace, find a little bit of a shade that you can sit under, and this makes sure that the sunlight is not too strong that the baby's skin will get sunburns. And also the time, how long you should expose your baby. So just start from 10 to 15 minutes, and maybe 2 to 3 times a day should do the trick. And another thing you can keep in mind is to keep your baby hydrated, as sunlight will tend to heat your baby up. So make sure to feed before and after the sun exposure, so that the baby's body will cool down. So these are the two things that we mothers can do, is feed and expose our baby to sunlight in order to help their bodies fight off this jaundice. But if these methods are not working, and if you feel that there is an increase in the level of lethargy, the level of tiredness, and the baby is still not showing active signs, he is showing signs of jaundice, then you have to call your doctor, and as I said, he will do the test. And if he confirms that the level of bilirubins are worrisome, what treatment they give in the hospital is the blue light therapy. So basically it's just a blue box, and they put the light from on top of it and under it, and the baby is just placed over there in a diaper, and maybe glasses are given to the baby to protect his eyes, and a blue light is shined on baby's body. So this does the same thing of helping the body convert bilirubin into a form which is easily processed by the liver and excreted. So basically, if your baby is having a little bit of jaundice, phototherapy of 1 or 2 days might be okay, and you might be ready to go home with your baby. Your doctor will tell you. I just want to assure you that it is very common nowadays, especially in the Western countries, for the babies to have phototherapy of 1 or 2 days, because in the Western countries the sun is not that strong and they don't get sunlight for so many hours in a day. So phototherapy is not a very big deal. In fact, it will help your baby's body to just it is like a support system that you give to your baby's body for digesting this bilirubin. In very severe cases, a blood transfusion might be needed, but that is very rare. I mean, I am not a doctor, but I have seen in my research that it is very rare. So what is blood transfusion? Is some of the baby's blood is replaced by new blood, like a donor blood. So because the donor blood is having lower levels of bilirubin, and that averages out the total bilirubin in the baby's blood, so it is very rare, but this treatment is very effective. It will make sure that the levels of jaundice are controlled, and your doctor will tell you more about it if needed, but that is very rare. So in most cases, at home we monitor our baby's eyes and the color of the skin, and alongside we feed our baby continuously, we expose our baby to the sun, and that should do the trick. If that is still not helping and your baby needs a little bit of more support, your doctor will do the test and confirm that phototherapy is required or not. If phototherapy is required, just 2 to 3 days of phototherapy would be good to go for your baby. If it is not very severe and everything else would be normal, your baby's liver will also learn how to process this bilirubin in the meanwhile, and it will mature. So within a week or 2 weeks, the level of jaundice should be gradually decreasing, and if not, then your doctor will tell you what steps to take next. That's it for now. See you next time. Come back soon. Bye.